Best way to understand bipolar disorder is at North Pole and South Pole. So when it's North Pole, it's usually mania or hypomania, and your mood is excessively high, euphoric for without any reasons. Whereas the South Pole would be depression, where you're extremely low, don't feel like doing anything, maybe even.
World Bipolar Awareness Day is on 30th of March, and it commemorates the birthday of Vincent van Gogh. He had bipolar affective disorder. He was a great painter. So I think that should answer the question that can you be successful? Can you manage to do creative things, or can you manage to be a big enough or famous person with bipolar affective disorder?
You can hold any job, any career in this world with bipolar affective disorder. Literally any. You can be a doctor, you can be a teacher, you could be a painter, you could be a singer, you could be a pilot. Your disorder cannot come into the way of you being who you want to be. These are some alleged famous people who've had bipolar affective disorder. I'm not their psychiatrist, so I don't know for sure, but that's what the internet says. Remember, your diagnosis is not your identity and not a limiting factor.
Mood swings doesn't automatically equate to bipolar disorder. Repeat after me. Just because you have mood swings doesn't mean that you have bipolar affective disorder. Mood swings can happen in a bunch of other medical conditions and psychiatric conditions. Mood swings can also happen normally in just day-to-day life. It happens to you, it happens to me, it happens to everybody. So just because you had a mood swing doesn't mean that you have bipolar affective disorder. When would it mean that you need to see a specialist? If your mood swings are pervasive, they're happening for a long period of time, when a manic phase, which I've talked about in some of my other reels, lasts for at least a minimum of 7 to 10 days, when a depressive phase lasts for at least a minimum of 15 days. So it's pervasive. It's not just one day of mood swing. It's not just a few days of mood swings. Also, the intensity might be a lot more of going up and down extremes. So please repeat after me. Mood swings doesn't automatically equate to bipolar affective disorder. Stop saying that I act so bipolar sometimes. Stop saying that mood swings means bipolar affective disorder. Stop saying that just because somebody blows you hot and cold or is angry suddenly has bipolar affective disorder. If you want to know, this news made me happy and sad together. Happy because we're recognizing that individuals with mental health disorders and diseases can function to their optimum level and be appointed to important positions, even in judiciary system for that matter. Sad because I did not really enjoy the term bipolar man being used. It was almost as if this person's identity was being labeled with a mental health
Bipolar disorder or bipolar affective disorder is so widely misunderstood. This article encompasses most of the major points about it. You can check out the Millennium Post article to know more.